basic concepts in homeostasis. So, milieu interior is the internal environment which should be maintained or which should be stable for the independent existence of organisms. So, an internal environment should be stable for the existence of organism. This was first proposed by Claude Bernard. So, what happens if the internal environment is not maintained? The external environment can creep in and it loses the stability. But how is this internal environment maintained? This stability is a dynamic process maintained by different organs. This was proposed by Walter Cannon. So heart, lung, kidney, everything maintains the stability of the internal environment. But what happens if there is a breach in the internal environment? The organs will come together to maintain the steady state. That is what was proposed by John Hunter. So the heart, kidney, lung, everything will come together to prevent that breach and maintain the stability of the internal environment. But this is not always the case. Sometimes we know that when the breach is great, lungs, heart, nerves, everything will fail. That is, the internal environment can no longer be maintained, especially in sepsis or severe polytrauma. The internal environment cannot be maintained, and in those cases, we need resuscitation, surgical intervention, and critical care. All these branches are developed based on this concept of maintenance of the internal environment. So, metabolic response to trauma is not always the same. Why? Sometimes the organs can contain the trauma by maintaining the internal environments. Sometimes the organs will fail. It will depend upon the status of the patient's condition and the level of injury or trauma.